As we move more into a digital world, a software, a technologically driven world, you can see the frailties of those sort of older procurement models, and I think governments recognise we need to develop sort of slightly different models about how we go about procurement or ongoing payment and partnership working to allow ongoing development of our systems.
The NHS takes 17 years to apply something at scale across services from the point it was proven. The problem is the digital sector moves in months, not years, and so by the time you have understood what this new thing is, it's probably been replaced by a new generation of that thing. So at the moment that's a real struggle.
The change in the paradigm that we currently have in healthcare on a global basis, which is more the concept of an empowered, involved, engaged patient, being in charge of themselves and their own healthcare, being involved in that. It looks like it's a thing that many people want. A further aspect of sort of patient empowerment and patient access to data is actually just getting the data. For many systems, many jurisdictions, one individual's data will be held across various different domains. That can lead to us technical challenge to connect all of that from our, some ways, fragmented systems. So they're still going to have mechanisms to allow patients to translate the data into their own personal understanding for their health and being empowered to manage their own care. So that pulling together of the patient data is an important part.
The way we like to conceive of it is, if you think of the person at the centre of a network of people sharing data, there's a circle around that person of organisations trying to do things with and for that person. Then the path of least resistance, one of those organisations to share with another organisation, is through the middle of the circle, i.e. through the person. So the person is a point of integration. They're the only person involved in all of the interactions about them. And so there's a premise that says, with their consent and giving them the power, they could share data far quicker and more readily and easily than all these other systems would do without them. Because the information governance and the ethical issues and the data protection issues and the privacy issues around one organisation sharing data with another about someone are quite hard to deal with. So giving the person an active role in that could actually give us an easier route to share data, and one that empowers the person.